How can LGBTQ individuals practice safer sex for STI prevention? Have you ever wondered how LGBTQ individuals can take charge of their sexual health and prevent sexually transmitted infections? Let's break down some straightforward and effective ways to practice safer sex. First and foremost, using condoms is key. They are one of the best tools for reducing the risk of HIV and other sexually transmitted infections. Latex or polyisoprene condoms work well for anal and vaginal sex. For those who are receptive partners, internal condoms are a great option. Always remember to use plenty of water-based or silicone-based lubricant. This helps prevent condom breakage and reduces the chance of tissue tears, which can lead to infections. Avoid oil-based lubricants with latex condoms, as they can cause them to break. Make sure to change condoms between partners and when switching between anal and vaginal sex to avoid cross-contamination. When it comes to oral sex, dental dams or latex gloves can be used as barriers. These can help reduce the transmission of infections like herpes or syphilis. Regular testing for sexually transmitted infections is essential for everyone who is sexually active. Testing helps catch infections early, making treatment easier and reducing the risk of spreading them. For gay, bisexual, and other men who have sex with men, testing at least once a year is recommended. If you have multiple or anonymous partners, consider getting tested every 3 to 6 months. This is important for all LGBTQ individuals to know their status and protect their partners. Biomedical prevention methods are also available. Pre-exposure prophylaxis is a medication taken regularly before potential exposure to HIV. It can significantly lower the risk of infection. Post-exposure prophylaxis is an emergency treatment that must be started within 72 hours after possible exposure to HIV and is taken for a month to be effective. Additional safer sex practices include avoiding sharing sex toys. If you do use them, make sure to use condoms on the toys and change them between partners or different body parts. Washing hands and genitals after sex is another simple way to reduce infection risks. Understanding that the risks of sexually transmitted infections vary depending on the types of sexual activities and anatomy involved can help LGBTQ individuals choose the right protection methods. Open communication with partners about sexually transmitted infection status, boundaries, and safer sex practices is vital for mutual health and respect. By combining barrier methods, regular testing, biomedical prevention, and informed communication, LGBTQ individuals can significantly lower their risk of sexually transmitted infections while enjoying healthy and satisfying sexual relationships.